Good afternoon, Representative McMorris-Rogers and members of the Committee on Energy and Commerce. My name is Isabella Piccinini, and I'm a registered nurse and doctoral student in the Nurse Anesthesia program at Old Dominion University. I'm here today with several of my colleagues, also fellow advanced practice nursing students, to express our strong support for House Bill 7856, the Prevent Diabetes Act. As a future registered nurse anesthetist, I'll care for patients facing serious complications from type 2 diabetes, many of which could have been prevented with earlier intervention. This bill is an important step toward a more proactive preventative care, particularly for older adults at high risk. House Bill 7856, introduced by Representative Jiguet on April 2, 2024, would amend Title 18 of the Social Security Act to provide permanent Medicare coverage for diabetes prevention program services. It expands the Medicare Diabetes Prevention Program, allowing eligible individuals to access structured, evidence-based interventions aimed at delaying or preventing the onset of type 2 diabetes. Today, we'll highlight the bill's core components, its expected impact on health outcomes and Medicare costs, and its current status in the legislative process. Each of us brings a unique nursing perspective, and together we'll show why this legislation matters, clinically, personally, and nationally. Let me now introduce my colleagues who will walk through the details of this important legislation. First, you will hear from Samantha Serio, a psychiatric mental health nurse practitioner student, who will begin the bill's purpose and the importance of preventative care practices for older adults. Next, you will hear from Kia Spence, an advanced practice registered nurse and doctor of nursing practice student, who will outline the key provisions of the bill, including the Medicare Diabetes Prevention Program's structure and delivery. Then you will hear from Evelyn Reyes-Forrest, also a psychiatric mental health nurse practitioner student, who will speak on the bill's impact, from improved outcomes to cost savings and expanded access. And then finally, you will hear from Lorna Parsons, a family nurse practitioner student, who will review the legislative process and current status of the bill. And with that, I will turn it over to Samantha to get us started.
I want to express gratitude to the Committee on Energy and Commerce for granting us an audience today to request support on House Bill 7856, the Prevent Diabetes Act. My name is Samantha Serio, and I'm a Master's of Nursing student at Old Dominion University and registered nurse at VCU Health in Virginia. In my experience as a registered nurse, I have cared for patients experiencing urgent complications in the emergency department due to uncontrolled diabetes, as well as post-surgical patients suffering from poor healing and outcomes due to diabetes impacting their abilities to heal. These are just a few examples of how I have personally witnessed the complications associated with diabetes in my professional experience, but the complications of diabetes are widespread and devastating, including amputations, blindness, stroke, dementia, and death. Diabetes is a highly prevalent disease in the United States, especially among older adults. An estimated 38.4 million people in the United States had diabetes in 2021. The percentage of people with diabetes increased with age, reaching 29.9% of all adults ages 65 and older, which is the same age that Americans are eligible for Medicare. High prevalence comes with high healthcare spending costs. People with diagnosed diabetes account for 1/4 of every healthcare dollar spent in the United States, totaling at a staggering $412.9 billion in 2022. These medical emergencies, complications, and exorbitant healthcare costs can be mitigated by implementing early intervention programs to prevent the onset of diabetes, especially in those who are considered high risk. Early intervention for pre-diabetic patients significantly reduces the incidence of progressing to diabetes and effectively lowers all-cause mortality. Prediabetes can be treated and potentially reversed through lifestyle changes, such as regular physical activity, weight loss, and dietary changes, all of which are encompassed under the Medicare Diabetes Prevention Program. I am asking you all to support the Prevent Diabetes Act in order to expand coverage and access to the Medicare Diabetes Prevention Program, thus providing life-saving preventative healthcare services for at-risk Americans. Thank you.
Hello, Representative McMorris-Rogers and committee members. My name is Kia Spence. I'm a family nurse practitioner from Norfolk, Virginia. I am speaking to you today in support of the Prevent Diabetes Act because I have witnessed firsthand the devastating impact of diabetes, particularly among those with limited access to education and support. I am passionate about this act because millions of Americans are living with diabetes or prediabetes. In fact, 1 in 3 individuals have prediabetes and will have diabetes within the next 3 to 5 years. Evidence has proven that lifestyle changes can decrease the risk of diabetes by more than 50%. In 2018, the Medicare Diabetes Prevention Program, a program tailored towards Medicare beneficiaries, was launched to help prevent or delay diabetes. This provided a once-in-a-lifetime series of CDC-approved structured sessions that guided participants to improve their diet, exercise, and overall health. It also connected them with coaches and peer support for ongoing encouragement. The original program was very impactful, but the lifetime limit held people back from getting continued support. One of the most transformative aspects of the Prevent Diabetes Act is the elimination of the lifetime limit on participation in Medicare diabetes prevention programs. This change recognizes that diabetes prevention is not a one-time effort, but an ongoing journey. By removing this restriction, we can ensure that individuals who need additional support can access the program as needed. This is critical for at-risk populations who face recurring challenges in maintaining healthy habits. Therefore, I urge you to consider the impact that this legislation will have on the lives of millions of Americans. Thank you for your time and for your commitment to improving the health care for all.
Committee Chair Representative Kathy McMorris Rogers and distinguished members of the committee, thank you for the opportunity to speak today. My name is Evelyn Reyes Ford, a registered nurse in support of HR 7856, the Prevent Diabetes Act. I'm here to highlight the important benefits and impacts of expanding access to the Medicare Diabetes Prevention Program, MDPP. The MDPP is a proven, evidence-based program that helps individuals at risk for type 2 diabetes make critical lifestyle changes. The health benefits of this program are profound. Participants experience weight loss, an increase in physical activity, and improved blood sugar control, all key factors in significantly reducing the risk of developing type 2 diabetes. By addressing these risk factors early, the program not only prevents the onset of diabetes, but also contributes to the overall improved health and quality of life for its participants. In addition to these health benefits, there are also substantial cost savings for our healthcare system. The cost of preventing diabetes is far less than the ongoing cost of treating complications associated with the disease, such as heart disease, kidney failure, and neuropathy. Diabetes management, which often requires extensive care, medications, and frequent hospitalization, places an enormous financial burden on the healthcare system. By expanding access to the MDPP through Medicare, we can reduce these long-term healthcare costs, saving taxpayers and the government billions of dollars over time. Preventing diabetes before it takes hold is not only healthier, but also a more cost-effective solution. Moreover, HR 7856 addresses an important issue of access. Many at-risk Medicare beneficiaries do not currently have access to a diabetes prevention program. This bill will change that, ensuring that Medicare recipients, especially those in underserved and vulnerable communities, can participate in a cost-effective, evidence-based program that has been shown to significantly reduce the risk of type 2 diabetes. It is a critical step in ensuring health equity, making this life-saving program available to all those who need it. In conclusion, the Prevent Diabetes Act offers clear benefits. It will improve the health of Medicare beneficiaries, reduce healthcare costs, and ensure that more people, especially those at high risk, have access to the program that can prevent the onset of diabetes and improve their long-term health. I urge the committee to support HR 7856 and recognize the profound benefits this legislation will bring to millions of individuals across this nation. Thank you for your time and your consideration.
Good day, Representatives Smith, Rogers, and committee members. My name is Lorna Parsons, and I'm a family nurse practitioner student at Old Dominion University. I'm here today to ask you for your support on H.R. 7856, the Prevent Diabetes Act. This bill promotes the prevention of diabetes. The accessibility of this program would help Medicare patients learn how to prevent diabetes. The program would be life-changing to our citizens at risk with no limitations on the education provided by the bill. This means if a patient were to be hospitalized or something tragic happened and they stopped the program, they could restart at any time. In April 2024, the bill was sent to the Committee on Energy and Commerce that handles healthcare policy, and it was also sent to the Committee for Ways and Means that handles Medicare. My grandparents both had diabetes, which was extremely costly at the time and is costly today. Their children educated themselves to prevent diabetes from happening to them. What would happen if millions of people became more educated on prevention of this terrible disease? We could potentially save billions of dollars in medications and healthcare costs. Prevention is key in any disease. With education and prevention, our citizens can live longer, healthier lives. We could save billions in healthcare costs as a nation. As of March 2025, the Congressional Budget Office that produces cost estimates for select bills and resolutions has not yet received the bill. The cost of prevention of any disease is a lot lower than medications and healthcare costs of diabetes and other diseases that diabetes contributes to. Thank you for your time and consideration to support the Prevent Diabetes Act. Together, we can make a difference in the lives of millions.
Thank you, Samantha, Kia, Evelyn, and Lorna for your thoughtful contributions. And in closing, we respectfully urge the committee to support House Bill 7856, the Prevent Diabetes Act. Making the Medicare Diabetes Prevention Program a permanent benefit and expanding access through virtual and evidence-based delivery can reduce the growing burden of type 2 diabetes, improve long-term outcomes, and lower healthcare costs for Medicare beneficiaries. Although we represent different areas of nursing, from mental health, primary care, and to anesthesia, we share a common belief that diabetes prevention must be a national priority. This legislation offers a proactive, patient-centered approach that aligns with the vision and strengthens our healthcare system overall. Thank you very much for your time and attention today. We welcome any questions or further discussion from a healthcare perspective. Thank you and have a nice day.